Researchers have found that some people with monkeypox are not presenting with typical symptoms, and their disease could look more like a typical STI. A study looking at people diagnosed recently found that many of those infected have only single genital lesions, or they have sores within the mouth or in the anus. The standard symptoms for monkeypox include sores and scabs across the body. But the research led by Queen Mary University of London said that expecting to see this could be a problem as the disease may not be identified immediately, even by doctors. In some people, anal and oral symptoms have led to people being admitted to hospital for management of pain and difficulties swallowing. This is why it's so important that these new clinical symptoms be recognized and healthcare professionals be educated on how to identify and manage the disease. Misdiagnosis can slow detection and thus hinder efforts to control the spread of the virus. There have now been 2,050 confirmed monkeypox cases across England so far, with the majority based in London. At the moment, the disease is disproportionately affecting men who have sex with men, with 98% of people in this group. But the researchers warned that although sex was the most likely way these patients picked up the virus, it can be transmitted by any close physical contact through large respiratory droplets and potentially through clothing and other surfaces. They warned that it's very important to be able to correctly identify monkeypox because there is a global shortage of both vaccines and treatments. Recognizing the disease, contact tracing and advising people to isolate will be key components of the public health response. For more updates, subscribe to this channel and hit the bell icon.